Lou isn't logging on. I have let's turn this up a little bit. I have a reflection. Good evening, everybody. Hey, Allison. Haven't seen you in a bit. We're on quarantine. What? Oh, if I can see what these are. I have blue reflections on my face. But anyway, good evening, everybody. Thanks for logging in and coming on. I'm just going to give it a few minutes for everybody to, hey, Monica, to come on. It's a lot. It's a lot going on, man. It's a lot going on. Thanks, Allison. Try to put a little makeup on for the people tonight. Try to look a little alive. So, guys, there's a lot going on, of course. Hey, Mel, how you doing? COVID-19. I want to talk a little bit tonight about anxiety, but I wanted to also mention a little bit about, obviously, the COVID virus. It's spreading, unfortunately. And, I'm always about how you can take better care of you. Hey, Harry, how you doing? How you can take better care of you. And in regard to what we're seeing with COVID, with this virus, we have got to take care of us, if you know what I mean. The way the system is set up right now is not incredible. Somebody said vitamins. Yes, vitamins. Building your immune system is incredibly important. Drinking water is incredibly important. And obviously the social distancing or isolation or self-quarantine. Hey, Karen, how are you? I'm not sure why it's taking us so long to put some stricter rules in place. If you look at China, they knew about COVID back in November, and they announced it to the World Health Organization on December 31st. And by January 25th, the whole country was essentially locked down. We've known about it since December 31st as well. And here it is, March. And we have yet to get the official shutdown. Hey, Tony, how are you? But in any case, not gloom and doom. I just want to tell you guys, I'm an OBGYN, so I don't consider myself particularly frontline with this whole situation. I don't work in the ED. I'm not in the ICU. That would be like hell for me. And I don't really do internal medicine and stuff. So I don't really consider myself to be particularly frontline. But a couple times a month, I have to do what we call walk-in call or ER call. And what ER call actually is that anyone who shows up at the hospital who is considered unassigned becomes the responsibility of the doctor that's on walk-in call. So these are women who have not had any prenatal care at all, haven't bothered to see a doctor at all. These are women, hey Donna, how are you? These are women who are supposed to go to the hospital on the other side of town and show up on our hospital because it's closer. These are women who are like traveling, they decided at 9 months pregnant to be a good time to go see their mama in another state. And so they're traveling across state lines or whatever, and they're pretty far into their pregnancies. And so when they show up at our hospital, the doctor that's on walk-in call is the person that becomes responsible for that individual. So this past weekend, I was on walk-in call for 24 hours, And I had a lady come in. And this really, guys, and I'm just coming on here to tell you this. This was like my first, I guess, up close and personal situation involving like the COVID-19 virus. So most hospitals and stuff are checking your temperature at the door. Like you come in, kind of say, they check your temp, and basically if you're under a certain level, they let you in. If you're over, they don't let you in. However, if a woman's in labor, she has to still get seen and addressed and so forth. Anyway, so she, the patient has a fever at the door. The fever was like 100 and something. So they call me and they let me know, hey, Dr. Johnson, there's this walk-in patient here. She is in labor, but she has a fever, and she's from out of state. She's from a state that has quite a few number of the COVID cases. So this is like my first real, like, okay, let's put this protocol in place. And so as we're working her up, she goes in, she delivers the baby, but there's like, we have masks and all this stuff going on. And so I say to the nurse, I said, well, why don't we just go ahead and get her tested, put her on protocol. So the nurse says, oh, well, doc, it's not quite that easy. And again, this is like my first real interaction. I don't work in the ER, but shout out to my ER colleagues, my ICU, my ER, my med-surg colleagues who are really dealing with this every single day, up close and personal. Shout out to them, pray for them, keep them covered, because it's a lot going on. And unfortunately, the way the CDC has this thing structured, it's really not in our favor as far as really putting a good handle on this thing. And I'm just telling you not to panic you, but to encourage you to follow the isolation rules, because really they don't have a solid handle on it. So anyway, I'm like, well, let's test her. They're like, well, we can put her in a room with isolation, but before she can do the COVID test, she has to do a flu test. And I said, well, why? And they said, well, that's just the protocol that CDC recommends or demands, that before we can do a test for COVID, we have to do a flu test, test. So we do the flu test. So that takes about 5 or 6 hours to come back. So now it's the day she gets there, there's the next day. So then once the flu test gets done, they're like, oh, Dr. Johnson, fill out this link, and this link will tell you how to get the infectious disease doctor to call you to tell you if he thinks and you think she needs to have a test done. And I was like, you're kidding, like really? So they send me this link and I fill out all these questions. And on this link is still stuff like, have you been to Wuhan, China? Have you been to Italy? Or has the patient been to Wuhan, China? I think we've established at this point that Wuhan, China is not a factor anymore. People who are getting this infection who have never left their hometowns. So I'm not even sure why. I have to answer like 35 or so questions about where this patient had been and where she was from, has she traveled, and all this other stuff before I could even order the COVID-19 test, right? So then I ordered, we answer all the questions, we send it out, the infectious disease doctor calls me, I talk to him, we order the test. So now the test is pending. The patient will probably be home, she will be home before we get the test back. And that's gonna be what it is. She was a little angry because she said, well, I don't have anything. And I'm like, well, we just really don't know. They're treating her with isolation and precautions and stuff, but we really don't know what she does or doesn't have. So the short story is, it took us all this time, and it's going to be a solid 6 to 7 day window between the time she came in with a symptom and the time that we get a test result back. She will be out of the hospital, back in her community, back in her home, because right now she doesn't have a lot of symptoms, right? So anyone who tuned in last week, you guys know I told you 1% of all these people who have this virus do not have any symptoms whatsoever, right? But they still test positive for it. So I was like, this whole ordeal kind of got me really irritated. So I really started kind of digging and looking into some stuff. And so I just want to share what is behind the scenes and kind of what's really going on and why it is so important for everyone to isolate if at all possible. I'm not trying to say they're not telling us, but they're not telling us what's really going on as far as how this virus is spreading. So I just kind of outlined and went through how long it takes to even get the test and the test results back, right? So here's the real issue when you hear doctors and nurses saying, we're overflowing and stuff like that. The CDC is only reporting the confirmed cases of the virus. So that's why when you look at the TV on like Monday, it'll say like 500, but then by Tuesday, it's like 620. Hey, Adrian, the CDC will only report once there's actually a confirmed case, which means that process I described before, that whole 7 days between symptoms and the test goes out and all that, it's not until that test actually comes back from the CDC and is confirmed that they will even report it in the number. And so you see the numbers like going up and up and up, because in every, and I mean, hey, Beatrice, in every hospital and at home, there are people who are sick. Some are really, really sick, and some are not that sick, who are waiting test results from the COVID. Hey, Pastor Scott, how you doing? And so until they physically get a positive test, they will not be reported in the number. So, and that's just the truth. The hospitals are being overrun now because there's so many suspected patients. So they're still treating them. Hey, Carlette, they're still treating them as if they have COVID-19. But until there's, hey, Central, hey, Doc, how are you? Until there is definitely a positive diagnosis from the CDC, they will not release those numbers into the public, right? And secondarily, I just learned from a very, very credible source that COVID cases that are being found on military bases are not being released at all, because that's considered federal information, and they're choosing not to release it. So for every like one reported and definite case of the COVID, there's very likely about 5 to 10 people who have not yet had a definite case and are sick at the hospital or at home, awaiting their results. And that's why the numbers seem like they're just jumping every day. Like it was 500, then it was 620, then it was 800, then it was, because as the results come back from the CDC, they're getting reported. So if they've done 200 tests in the course of like a week or whatever, it could wait like 5 days later when all those tests come back. If 25% of those tests are positive, then that's 50 more cases of COVID that they begin to report. And so what happens with that is it seems like it's flooding. Additionally, there are people who are dying before their tests come back. And so they're not considered deaths at the time, but again, not until their results are brought back from the lab, post-mortem, as they say, are when they actually get reported in those numbers. So saying that not to scare anyone, saying that not to freak out anyone, but to really just bring awareness that I'm not a part of the CDC, but the way they're handling and managing this, they're kind of keeping stuff from us to a degree. And they're just, we're not getting all the information we need to get when it comes to what's really happening on those front lines. So just remember, for every one case they're telling you they found, there's about 5 or 6 more on the low end that are waiting results. I did some research about the city in Georgia, and they had like 400 people that were waiting for test results to come back to see whether or not they actually had COVID-19. And so I just was like, I wanted everyone to know this is why the social distancing and the staying away is super, super important, because you can go to the hospital, be tested for the flu, be told you don't have the flu, it's just something else, and they're sending you back out and you're in the population. If you have any symptoms at all, fever, cough, and I know, like, it's crazy because it's hay fever season. Georgia has the worst pollen I think I've ever seen anywhere. Just everything turns yellow. The cars, the streets, the porches, everything is just yellow, and everybody's sneezing on a good day in Georgia in the springtime. It's terrible here. We're all stuffy, we're all sneezing, we're all a little bit wheezy because we have all this pollen. But now people are like scared to sneeze. They're like they're going like that because they don't want to think it's COVID. But the symptoms of COVID are the fever is one of the main symptoms, even if it only lasts a day or two. And the cough tends to come. Sometimes there's a sore throat often, and then there's that cough that just doesn't let you go. And then in the worst case scenarios, you get a viral pneumonia and difficulty breathing because the lungs will fill up with fluid and you'll get a pneumonia. And Mel said, that's what I think causes mass panic. Right, people are being really relaxed with it. Like I said, I was on call over the weekend. Hey, Jazz, how are you? And I'm driving around. People were still outside, just outside, not at the grocery store, just chilling for no reason. And this is why this stuff is going the way it is. This is why it's spreading. If you just stay home. Just really, we got to stay home. I really believe that if we can get ourselves together and really stay home for maybe 2 straight weeks, just really isolate, then that will help to lower the curve. People are still going to get sick. The numbers are still going to go up. People will still die, even if we all stay home from this point forward. But the way that China and other countries have really gotten a tight grip on it is that they really strictly enforce the staying at home, going out for essential things, and coming right back. Hey, Drew. That's the main thing, is just that you have to go get what you need and kind of come home. Thankfully, the stores have been responsible and taken it upon themselves to close themselves, like some of the clothing stores and the other non-essential stores, furniture stores and stuff like that. But that first weekend, the weekend before last, people was just outside chilling. I drove past the jumping plays, and it was packed. And I was like, no, they can't be in here. But again, ladies and gentlemen, the hospitals are already working at capacity. They're really, really tight. And no, they're not saying they're all COVID, but there's a lot of suspected COVID. And those are the numbers that we're not hearing. They don't need anybody else to get sick right now. Nobody. You don't need to get sick from anything. So start taking your vitamins. When you go to the store next time, get your echinacea tea, drink your hot tea, your lemon, your ginger. Nobody else needs to get sick. Now, of course, there's other stuff you can be sick from right now. There's still cancer, there's still heart disease, there's still diabetes, there's still strokes, there's still accidents. But if you can help being sick for any reason over the next month, don't get sick, because the hospitals are really, really working hard to contain what's going on with COVID, and they are literally running out of space. Now, again, I'm not telling you guys this to scare you and freak you out. I don't want you fighting in the streets over toilet paper. I don't want you having panic attacks or anything like that about what's going on. But I want you to really be aware and be informed and be serious about it. If you have younger people and friends that's just going out, tell them stay home. If they don't need to be outside, just don't go. We're canceling some appointments, and we're still seeing pregnant patients because we have to. And I'm telling all of them, when I see them in the office, come in and see me and go back home. Don't go a lot of places, because you just don't know when you're going to come into contact. Another thing about this virus is that it's kind of weird in that it acts almost like a pox virus. Usually a respiratory virus, you get it, and then 3 to 5 days after being in contact with it, you have the symptoms and it goes through. This virus has a longer incubation period. So there's up to a 2-week window between the time that you get exposed to it and the time that you can feel sick. And I don't know how old you guys are, your age group, but I remember when I was little, I had chickenpox. And when chickenpox came to my school, it ran through the whole class. And like one girl had it and she went out sick. And then like another week went by, and then 1 or 2 other people got it. Then they went out sick. And then another week went by. So over the course of a couple of months, it ran through the entire class. And that's because with that type of a virus, the chickenpox virus, you're more infective before you actually have the bumps. Right, you're more contagious. Before you actually have the bumps, because obviously once you have the bumps, your mom keeps you home. But people were still getting sick throughout the course of the year. Well, this is kind of how this COVID virus reacts. You're contagious before you're actually sick, which is why it's so spreading like it is, because people feel fine, but they're still able to spread it. People feel okay, and they're still able to be like, hey, I'm feeling good. And then the next thing you know, by the time they physically have the symptoms, I believe, and I'm trying to find data to support this, I believe they're more contagious prior to the symptoms actually showing themselves. Obviously, it's particulate and that kind of stuff, but I believe that there's contagion that happens before we even have the fever and the symptoms, which is why it's been so easily spread. And I'm trying to find stuff to verify this. This is my own thought process, because otherwise that 2-week window wouldn't be there. They wouldn't be shedding virus for 2 weeks before they physically get sick. So again, guys, not to panic you, not to freak you out, not to make you have a panic attack or anxiety or anything like that, but just stay home. Just follow the rules. My thing is connected. Okay, I lost Instagram for a second. Just follow the rules. Basically, and follow the protocol. I have a question on Facebook. Can building the immune system shorten the time of the symptoms? I believe 100% yes. When you talk to people, so first of all, I believe, and as I've been talking to healthcare professionals across the state and other places, this virus has been around for longer than we think it has. If you go back to some of my Facebook groups and stuff, I'm seeing a lot of people talking about these atypical pneumonias that were going around as early as last October, that were just kind of being talked up to a viral pneumonia or some other element or ailment that people just weren't paying attention to. They weren't connecting the dots. And yes, there were deaths before December. And when you look at some of the CAT scans of these people who died pre having a name of COVID, their CAT scans and things look just like known COVID patients. So it has been around for some time. The symptomatology seems to be different based on age group and also based on your otherwise immune system. The younger people tend to have a milder set of symptoms. Younger people tend to have more of a shortness of breath, fevers pretty much across the board. Younger people have like a shortness of breath, and they have a lot of like head fogginess, ringing in the ears, light sensitivity, sound sensitivity, difficulty with taste buds, etc. And then the cough, but the cough in a younger person tends to last for a shorter period of time. And when I'm saying younger, I'm saying like 35 and under, if they're in decent health. 35 and over, I'm using as a cutoff, tend to get that, they get the fever, may have nausea and vomiting that lasts a day or so, may have a fever for a couple of days, weakness, but then they typically get that cough that doesn't let go. According to some of the stuff I've read, drinking water regularly helps to diminish the symptoms, and that drinking hot things like hot teas, hot water with lemon and so forth like that helps to, the virus doesn't like heat, so it doesn't grow as quickly or as well when you're drinking a lot of hot stuff. But a lot does depend on your immune system. Me personally, even though I'm a doctor, I'm not a big medicine girl. And I swear by echinacea, as soon as I feel any scratch, my throat gets scratchy, anything happens, I start popping echinacea like 3 times a day. Just my personal hint. We have echinacea teas, ginger, and so forth like that. Because it helps to boost your immunity. Golden seal is another herb that also helps to boost your immunity. And so for me, as soon as I feel any little scratch of anything, and this is before COVID even started, I start popping echinacea because I want my immune system to be strong enough to fight off whatever may or may not come my way. So, to answer you, that was a long answer to a short question, but yes, building your immune system can shorten the symptoms and help you to get through it with a much milder event. But as I said previously, as I ask around, as I read comments from other providers across the state and across the country, this thing has been floating around in lesser forms. We didn't know what to call it, but it's been kind of hanging around for a while, and they were just not really calling it that. But if you look at the symptoms, if you look at the profiles, and if you look at the scans and the radiology from pre and post having it a name, they are 100% the same. So it's just that at this point, it seems like it's picking up the speed, picking up the pace, and more people are getting it. It seems like it's faster. So remember, for people who are, it's only the confirmed cases they're telling us about. So for every one confirmed case, there's probably 5 to 7 that are undiagnosed or waiting on test results. And the CDC, unfortunately, is not really making it easy. I don't know how the whole NBA got tested in like 3 weeks, because I had to jump through hoops. Well, I know, but I had to jump through a couple of hoops to get one young lady tested who had a fever. So, guys, just we got to say we're in this together. I'm in this with you, but you got to take care of yourselves. Stay home. Don't go out if you don't have to. Start drinking your water. If you ever wanted a good time to get healthy, this is the time to get healthy. Eat your vegetables, drink your water, drink your herbal teas, your green teas, things that are going to boost your immune system so that you can stay healthy through this entire process, because we got to make it to the other side, guys. and we have to flatten the curve. And the way we do that is by you guys just really staying home, staying with your own loved ones. And if you feel anything, just don't go out. Like, don't go outside. I mean, unfortunately, the medical system, we're not doing a great job with this because of the CDC at finding these cases early enough before they start to really spread. They're not doing a great job because, and it's no fault of the doctors themselves, but they're working within the confines given to them by the CDC. I can't imagine being an ER doctor and having to do that long questionnaire for every single patient I thought had COVID. That's crazy. Like, I just heard of a lady today who, not to mention the fact that they don't have the equipment. I heard of a lady today who unfortunately passed away. One of the reasons was she was highly suspicious for having COVID, and the hospital she was at didn't have any gear. And the nurses was like, I'm not going in there. She had all the signs and symptoms. She was a renal patient on dialysis, and the nurses were like, we need to have some gear to go in there because the thought is that she definitely had it. And unfortunately, she passed away. Someone asked about elderberry. Elderberry is also good, although I've seen things that said that for this particular virus, elderberry is not the best thing. And an apple cider vinegar as well. You can drink that in moderation. Remember, ladies, too much apple cider vinegar gives you BV because it throws your immune system off. So that's it, guys. They want to alarm you, want you to be aware and conscious about what is going on out here and how you can stay safe. Stay home. I'll see you next week. We'll talk about anxiety next week because at the end of this, we all might have a little bit of anxiety. At least we hope not, but probably we will. So anyway, love you guys. Take care of yourself. Thank you so much for tuning in. Please share this. Tell your friends. Share the information. We don't want you guys to get sick. I don't want you guys to get sick. I have a lady I know who's right now fighting for her life in Detroit. And she's a cousin of a friend of mine. And she's fighting for her life right now. So please, 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 I don't want anyone that I love to be fighting for their lives out here with the COVID. So good night. God bless. Take care. I'll see you next week.